And we're very excited to have the North Dakota Department of Health Equity Office providing a panel for us today. And for those of you who saw the introduction, we're talking about the work of what is a relatively new initiative in North Dakota. Christy started in 2018 and has now created an office with 12 full-time staff and 7+ interns. And they've been an amazing partner for NDSU in terms of providing intern opportunities for our graduate students. So we have several of the presenters on right now. Chrissy Gerard, is it Beverly Anelli, Katerina Dimitrovich, Sargam Gamir, Alicia Belay, Valentina Asichu, and Julia Wilson Peltier. So I'd like to welcome you and thank you very much for joining us today. And I will turn it over to you.
Thanks, Ramona. Hi, everybody. My name is Chrissy Gerard, and I am the Health Equity Director here at the North Dakota Department of Health, and I oversee the Health Equity Office. As Ramona said, this office was reestablished in 2018 after there hadn't been a health equity program for a few years at the department. And since then, it started with a half of Chrissy, is what I say, so half of a me, and it has obviously grown fairly substantially over the last year or two. So it's really exciting to see this, and we're really excited to be here and talk to you about a little bit about the work that we do. I'm going to start off the presentation with kind of the nuts and bolts, and then I will turn it over to some of the other Health Equity Office staff. And we do have the pleasure of 2 of our interns also speaking to you today on the work that they do for us here at the Health Equity Office. I will let each of the speakers introduce themselves right before they speak. So I won't introduce everybody. We'll just introduce as we go. Beth, could you hit the next slide, please? So the mission of the North Dakota Department of Health is to improve the length and quality of life for all of North Dakotans. Next slide, Bev. This plays into the Health Equity Office mission as we work to really understand health equity disparities and really look at reducing those disparities here in North Dakota. We really want to make sure that all North Dakotans receive the highest quality of health, therefore receiving the highest quality of life. Next slide, please, Beth. I'm going to share with you a few organizational charts, and I know this isn't the most exciting. I say I get the least most exciting part of this presentation, to be honest with you. So I'm going to show you a few organizational charts just so you understand where the Health Equity Office is. So this is the overall Department of Health organizational chart. Health equity is actually under the Healthy and Safe Communities section. That's the 3rd section in from the left. We are the 3rd one down there. And I point this out because the Health Equity Office, even though it is in a section, we still do work for the whole department. So it's not just Healthy and Safe Communities section that we do health equity work for. It is the entire section, or the entire department, excuse me. The department has an overarching goal, and that is to improve health equity and assess the impacts of the social determinants of health. So it is important that this office does do work for the entire department. Next slide, please. On to our second organizational chart. So this is the Healthy and Safe Communities section. Kim Mertz is the section chief. There are 2 offices and 4 divisions within this section. One of those is the Health Equity Office, which you'll see on the top right. Next slide. Which leads us into the 3rd and final organizational chart, which is the organizational chart for the Health Equity Office. So we actually have 13 staff, including myself, and also 7 interns at this point. So we have an administrative assistant. We have 4 tribal health liaisons. We have 1 tribal health liaison for each of the tribes in North Dakota. However, you'll notice that Jamie has 2. She not only has Spirit Lake, but she also has Sisseton and Wahpeton as well. So they are the primary contacts for each one of those tribes, and they serve as a liaison between the department and that particular tribe. We also have we also have a special populations coordinator, a health equity COVID-19 coordinator, Alicia, whom you'll hear from a little bit, she is the Assistant Health Equity Director, and underneath her, we also have a position specific just to immunizations and health equity. Sargam is our new American Foreign-Born and Immigrant Health Liaison, whom you'll hear from in a little bit as well. We also have 2 CDC Public Health Associates. So you'll see Ruth and Bev are both listed as a CDC PHAP. So those are positions that are actually given to us from CDC. It is a competitive application process that we apply for. We've been fairly successful. The Healthy and Safe Communities section right now has 3 public health associates. Ruth just started with us about a month ago, and Bev is now on her 2nd year with us here at the department. We will have Bev for another year, and they're just 2-year stints. So as soon as the 2 years are up for those individuals, then they will go on to other things that they choose in their public health careers. Next slide, please. I did want to just take a few minutes to talk about what's on our website, because I think it's pretty important for individuals to understand if they're looking for any health equity resources. We have a lot on there. One of the things you'll find is a tab that talks about our state leadership. That'll show you like the org chart that I just showed you with the Health Equity Office, but it also highlights what each position does. So if you want to look a little bit more in depth of what each one of us is responsible for, that's listed on there. We also have an area that talks about our strategic plans. We have 2, which you'll hear about in a little bit. We have one that's specific to the Health Equity Office, and we also have a specific COVID-19 health equity plan. What we found out through this pandemic is a lot of the grants that the state has received has a huge focus on health equity. So we have a specific plan just for that. The website also talks about all our advisory boards, which I will talk about in a little bit. We also have an area that is just related to COVID-19 and health equity. And important to note on there, if you're looking for any COVID specific translated documents, you'll find those on that tab. We also have an area just for general resources. We highlight a lot of the federal health equity websites that have good content. We also highlight some of our own resources we've developed, some of our trainings. One of the most recent trainings that we developed was in a collaboration with the National Association of Chronic Disease Directors. There's a cultural competency training, which is quite new on there. It's a pretty simple, just 60-minute overarching cultural competency training. So if you're interested in learning a little bit more about cultural competency, it's a really good training. And the instructions for accessing that training are on that website as well. The other thing is, if you want to just gauge your knowledge in health equity, there is a health equity quiz highlighted on all of our pages too. So if that's something you're interested in doing, you can also visit our website for that. We do have a lot of examples within our resources. We have videos and things like that. So we actually thought it'd be kind of nice today to break up the monotony of us talking at you, to be able to watch one of the videos that we created in coordination with Kat and company a couple of years ago. And this video is just a little bit of overview of what the social determinants of health are. So if Bev goes to the next slide, hopefully that'll play. So that's one of the videos that we have on our website. We all love that video. So when we were voting on which video to show you guys, that's the one that we picked. But Kat did a really good job on that video. And so there's videos like that. There's a video that was created that explains the difference between equity and equality. So that's a really good one too. So if you're interested in any of those resources, please feel free to visit the website. And the last slide from me is just to talk and make a little plug, I guess, for our Health Equity Office advisory boards that we have here at the department. So currently we have 3 advisory boards, and really they all do the same thing for us. They bring us recommendations regarding health issues from their specific community. And we take those and bring those back to the respected area of the department that needs to hear about those. And we also ask them for feedback. So we ask for feedback on anything from materials that we create, media, communication, and interventions that we're looking at developing, among a lot of other things. These boards, the first board that was created was the New American and Foreign Born and Immigrant Advisory Board back in June of 2020. And since then, now we have 3. So these 3 advisory boards are still relatively new, but just in the little time that we've had them, have done an amazing job for us and have provided the department with a lot of information. The first advisory board on here is the BU. That is our LGBTQ2S+ advisory board. That board is made up of allies and providers and or members of the LGBTQ2S+ community. And I will put in another plug that board right now is doing some active recruiting. So if anybody is interested in being on that board, the information is on our website along with the application form as well. The second board we have is a youth board. That group is made up of individuals between the ages of 15 to 21. And they really make sure that we understand the youth perspective when we are doing planning and decision making for the state. And I will tell you, this board has probably taught me more than any of the boards. They just have a different perspective and where we should be doing marketing. You know, we've had this whole new TikTok relationship that has started recently because of youth, and that's what they're watching. So they're advising us on where we can really hit that youth community. So it's been pretty amazing. And like I said, the New American Foreign Born and Immigrant Advisory Board, that represents a diverse and cross-section of individuals and organizations with a tie to those NFI communities. So right now, out of the 3, the BU is the only one that's actively looking for new members, but we make sure and let folks know as soon as we need more members for other groups as well. And then lastly, I'd like to just say that we are working on a 4th board, and this is in collaboration with NDSU and the American Indian Public Health Resource Center. So beginning sometime within the first quarter of 2022, we will have our tribal health board established at that point. So we're really excited and looking forward to that 4th board, helping the department and helping other agencies really understand what's going on in other communities. And I will turn it over to Beverly now for the next slide set.
Thank you, Chrissy. All right, hi everyone, my name is Beverly Anali. I am a public health associate with the Health Equity Office, and I'm just going to go over our office's strategic plan, which spans from 2020 to 2024. This plan really originated out of the NDSU's overall strategic plan that Chrissy mentioned, or also known as our strategic map. And it outlines the goals and directions for the department as a whole. And equity is a core part of that plan, and it spans across every single department at the NDOH. And so out of that knowledge came this specific plan that goes into detail as to how we're going to better assist all North Dakotans with receiving the highest level of healthcare, which is what we do. So on the front cover of the plan, and really throughout many of our documents, you'll see this interlocking symbol. And that is a committee-approved method of highlighting data disparities and health equity. And what's really exciting about this plan is that it's a living, breathing document that gets updated every month for public use. It's available on our website under Health Equity Committees, and it details right now about 20 SMART goals. So SMART stands for specific, measurable, achievable, realistic, and time-bound goals. And This plan also went through a more recent update where we added in several other strategies to address inequity across specific categories. So those categories included obesity, injury, training opportunities, and all these other sectors that you can see on your screen, including the advisory boards that Chrissy just mentioned. And so we also include identifiers that showcase what population groups are more likely to be reached by each activity, and then what specific accreditation standards are met. And lastly, we include in detail all of those who will be involved in working in that specific strategy and how we're going to measure success and when the activity will be completed by. So very, very much in detail. And then all of the goals we have in this plan originated from data that we do have and from just talking to community members as well. In fact, some of the goals that you'll see in the plan are simply to do that, to reach out to community members and grassroots leaders and ask them what their needs are, figure out what's really going on in the community so that we can really be a person-centered office. And we also have sections across the NDDOH that reach out to us about, having a specific equity need, and that's another way that goals or activities are made. So on this next slide, you can see some examples of goals that we have in this plan. So I apologize, it's a little too small. But our first goal in the plan is that by the end of 2023, the NDOH will improve data collection and tracking processes for health equity initiatives. And so underneath that, you can see a couple of objectives that are specific steps for reaching that overall goal. So first one, for instance, is to incorporate health equity initiatives into the overall NDDOH strategic plan. And that one has been completed by virtue of creating this plan. And then the second objective underneath that is to include health equity data initiatives into our state health assessment that's coming out. And so within all of these objectives, you can see how we're going to measure our success, who's going to be involved with making sure those activities get completed. Another example of a goal on here is our sixth goal. And this was one that Alicia actually led, and it was an amazing activity. And I'm sure she'll speak about it a little bit more, but it involves participatory grant making processes, which is an equitable way of sharing funding among partners. And so that too included specific objectives, steps on how we achieved that earlier this year. And then you can also see for both goals that we have domains highlighted, and those domains come out of the Public Health Accreditation Board to sort of showcase how we're addressing our accreditation standards. And then also with goal number 6, you can see some bubbles on there, and those are our population groups that are being addressed by that activity. They're all labeled and addressed at the beginning of the plan, but NFI stands for our New American Foreign-Born and Immigrant Population, and the R would stand for rural communities. So again, this plan is online, it's on our website. So feel free to go through, download it, print it out, scribble all over it if you need to, and share any feedback with us if you have any. Yes. So I will pass this presentation on to Katarina.
Hi, everyone. Thanks for letting us be here today. I am the Health Equity COVID-19 Coordinator, and my role in the office is basically everything COVID related when it comes to grants, management, working with basically every member of our office to discuss any potential projects that can address COVID-19 disparities in our state. That's the biggest part of our role when it comes to COVID-19 in the Health Equity Office. It's addressing any disparities that COVID-19 has revealed or has left behind in this pandemic. So I'm going to talk about the COVID-19 strategic plan. Like Bev's plan, we have this similar symbol on our plan. This is, again, a living public document that is updated once a month. And so I meet with members of our office to make sure that they are on track with projects, activities, if anything has changed, if there are new activities that we are adding to the plan. It's constantly being updated, which is really amazing for the public to have access to that. The main purpose of this document is to identify any activity to address needs and have partners listed in it, as well as have a tracking method. It does include 106 goals and activities to address COVID-19 disparities among special populations in North Dakota. I didn't realize how many goals and activities we had in this plan until I was counting yesterday, and I'm just blown away at how much we're doing for our state in the realm of COVID-19. And it truly does expand beyond COVID-19, but obviously that is our focus. So the sections or the categories of each of the goals are the Health Equity Office and activities we are using to address health equity and COVID-19 disparities across the state, focusing on new American foreign-born and immigrant populations, African American populations, American Indian and Alaska Natives populations, persons with disabilities, aging or elderly populations, LGBTQ2S+ population, homeless, and rural populations. Next slide, Bev. And so I also included just a snapshot of a few of our goals and activities. On the left, you can see that this goal is for the population of persons with disabilities. And it's just really a straightforward activity. Obviously, we have many under this category, but the activity that has been completed is creating a widely and publicly disseminating COVID-19 educational materials through appropriate statewide points of intervention to reach medical organizations and personnel regarding COVID-19 standards of care. And so obviously you can see how we lay out our plan. Bev was responsible for this activity. We have the date that activity is completed, or a goal in mind of when we want that activity completed by. We have measures of how we are going to measure if that activity was successful and completed, any partners that we are working with to complete that objective. And then we just have that tracking of, is it in progress or is it completed? And so obviously you can see that this one was completed. On the right-hand side, we have American Indian and Alaska Native populations that are really being addressed by this activity. And this activity is the Health Equity Office will contract with tribal organizations to increase rates, address hesitancy, develop and coordinate educational outreach. Sorry, it cut off to the next line. And so you can see that there are many who are working on this initiative, myself included, the tribal health liaisons, our immunization coordinator, Christy, special populations coordinator, and that it's kind of in progress, but we're really just getting it off the ground. And so our plan is just has included items that are completed that we are working on currently, as well as plans to implement those activities later on. So it's just a really great way to have all of our initiatives in one place. Bev, if you want to go to the next slide. And then at the end of our strategic plans, both the Health Equity Office as well as the COVID-19 strategic plan, we have this table, I guess, that is titled as Appendix A. And we just wanted to show how we as an office are tracking our progress on these strategic plans. So as you saw in the plans, we have in progress and completed. For our office, obviously, we break down by goal and the objective, our date of how we want to complete it or when we want to complete it, how we're measuring, who's responsible. But then we go further and we look at numbers served. We looked at, is it completed? Is it in progress? Is it getting off the ground? And then we have notes and tracking, which, as everyone in our office knows, that is the biggest section. And we just detail everything. And so when you are doing a strategic plan, that's probably the most important part of just detailing when you met with partners, when you took that initial step in setting up a meeting with the team responsible. That's really some of the most important work is behind the scenes and just charting how you are meeting those overall goals. So in our strategic plans, we just wanted an example of how our office is tracking it. And so that is what this is. So thank you. I will pass it on to, I don't know who's after me. Is it's Sargam, the NFI Health Liaison.
Thank you, Kat. Good morning, everybody. Before I get into the details of what I do as an NFI Health Liaison, I would just like to thank NDSU MPS department for having all of us here today and letting us speak and share what we've been up to in terms of COVID-19 in our work. Thank you so much for having us. So before I get into the specifics of my role here, I would like to walk you through my journey from being an MPH student at NDSU to my current role as NFI Health Liaison. So I joined NDSU in 2017 August, and I was under infectious disease management track. So in my first year, I think I did my assistantship with Dr. Danielson in her maternal and child health home visiting program for tribal communities, and it was a great experience. And after that, I transitioned to Kylie and Dr. Carson's team, and I did some work around the antibiotic stewardship program. So that was totally different, and again, really good learning experience for me. So during that same course, pandemic happened, and then I was pulled in by Kylie to do contact tracing for the state. And I was really nervous and excited for that opportunity because we were learning about big outbreaks like SARS and plague and a lot of like big pandemics. But how many of us get this chance to really work in a real life like outbreak like this? So I was really excited to work as a contact tracer. So I began tracing, and we really started at that like first phase where we didn't really have dynamics in place. We were working through case investigation forms, too many paperworks, and we were working from home, and it was like really interesting to see that transition of public health from that paper form of tracing to dynamics to where we're at right now in terms of tracing and vaccines and all other cool stuff. So while I was doing tracing, I think I did that for over a year. And we had a big outbreak at Grand Forks at a windmill. I think Kylie here probably remembers that very well. So during that outbreak in Grand Forks windmill, we came to know that there were a lot of non-English speaking employees there, and they kind of needed support in terms of isolation and quarantine. And a lot of those non-English speaking people were Bhutanese refugees people. And since I happened to speak the same language, I was pulled in to do the tracing for that particular group. So while I was tracing for that particular group, I kind of like felt that there is a big need for somebody to kind of coordinate the efforts between the state and that community, because a lot of the times people did not know about the resources that were available to them, like free testings. Like testing wasn't as easy as it is right now. So they went to Sanford and they would not be able to get tested because they would say, okay, do you have symptoms? No, then you cannot be tested. So it was kind of like difficult in those first few months. And we had so many free testing facilities and people didn't really know about that. And we just needed somebody to communicate those resources on a timely basis too. And people had so many questions and concerns about employment and what happens if they are isolating 10 days, and will their employer pay them for that time off, or what's the general guideline. And so it was really, I think there was a phase when I kind of like developed a little bit of interest to work in NFI community during that tracing process. And about the same time, I was also doing some of the volunteer works with Kylie in terms of like creating videos for the NFI group, just answering the frequently asked questions in like Nepali language for that particular community. So a little bit of work here and there. So all that work I was doing under Fargo Cass Public Health, because I was housed in their office and doing tracing from their office. So that's why I have Cass County Public Health here. And after that, I graduated in May 2020, I think last year. So right after, this year. Sorry. Yeah, this past May. So right after graduation, I had applied to this job, and here I am working as a NFI Health Liaison. So right now, we work with people from different ethnic backgrounds, different racial backgrounds, different languages, different needs, and so on. So that's how I have transitioned from being an MPH student at NDSU to my current job. So NDSU has really helped me prepare and get that knowledge and skills and those assistantship opportunities wherever I fit in. Those were really like time relevant and just helped me stay up to date with the latest like public health news and stuff like that. So really thankful for NDSU and the entire team here. And I feel happy that I know a lot of you present in this meeting today here. So thank you so much. And next slide, Bev. So my role as the NFI Health Liaison, so I basically work as that point of contact or that point of connection between the NFI community and the Department of Health, particularly the Health Equity Office. So this NFI community could be anywhere from, let's say, Sudanese or African or Liberian community or Bhutanese refugees community in the eastern side, or it could be the Hispanic community way out on the western side of the state as well. So basically, one point of contact for the entire New American foreign-born and immigrant community of the state of North Dakota. And I also work in providing COVID-19 education and awareness, and we do that through culturally and linguistically appropriate messaging. So our office also works on creating a lot of like fact sheets and flyers and frequently asked questions about COVID-19 or COVID vaccines and a lot of other issues like flu and what are the symptoms of flu, how do you differentiate flu and COVID, so all those materials, and we have them translated into top 11 or 12 languages that are spoken in North Dakota. And we put those in our website and also try to disseminate those with appropriate channels like local like immigrant-led organizations like ISARA or Afro-American Development Center, or use our other partners in the state as well for dissemination. And I also work with very closely with my colleague Kia Maya, and she is the Health Equity Immunization Coordinator. So we together work on like creating vaccine messaging to each individual NFI community in North Dakota. And a lot of my work is around like collaboration and partnership building and community engagement. So we do partner with a lot of internal and external partners. So I think Alicia will get into details about the partnerships and how that works. But some of the examples of the partnerships that we've had is North Dakota Department of Transportation to help people with transportation back and forth from the vaccine clinics. And I think we had that last year. So some other examples are we have partnered with South Sudanese Foundation, or we call it ISARA. So it's like a conglomeration of several smaller organizations that do immigrant-led work. That's other example. And so yeah, Alicia will get into details about the partnerships. And we also do a lot of like focus group discussions and stakeholder meetings across the state from time to time, and try to understand people's needs and just get feedbacks from them on what their community needs and how can we help that community develop, and how can we provide our services in more equitable manner. So that's the majority of my role here. And I also assist and facilitate the NFI advisory board meetings as needed. So Alicia is the chair for that meeting, and I kind of fit in as needed for that group. And we, from that advisory board meeting, we try to have like a bi-directional information sharing, and we try to share what opportunities we have within the state for communities. And we also get information from community leaders on what their needs are, or any feedbacks or recommendations, or any important input from the board members on relevant issues. And I also assist in activity efforts specific to the NFI group in the NDDOH Special Population COVID Strategic Plan that Katrina just mentioned. So basically talk about the activities that are specific to the NFI group and what I've been up to, and what activities are in progress, or what are completed. So basically work with Kat on that too. And I also assist in conducting disease investigations and interventions for reportable conditions in the NFI group. So right now our focus has been COVID, but slowly I think the role will be expanding in terms of other diseases as well. And I also work in providing education and awareness on chronic and infectious disease to NFI communities. So right now it's more about COVID again, but with time and with COVID maybe staying with us forever or maybe dying down, I don't know. But with time, we'll surely move past COVID and try to address other pressing issues in the NFI community as well. So that's basically all I do. And thank you so much. Now I would like to pass it on to Alicia.
Thank you, Sargam. So I'm Alicia Belay. I'm the Assistant Director of the Health Equity Office, and I'm just going to be talking about not specifically my role, but generally the collaborations and opportunities that we have here at the Health Equity Office to try to address social determinants of health. So as you saw from the video, if we're not addressing, working collaboratively across lots of partners, there's no way we could address social determinants of health. That's just a requirement in order to do our work. And we have 4 different ways that we are really partnering with folks. And so I'll just talk about a few key partnerships in each of those areas. So within Department of Health, within our Team ND across other departments, and then we'll talk about some partnerships we have across North Dakota, and then regional and national opportunities to partner. So 2 that I chose to talk about with internal collaborations within Department of Health, and there's many more, I'm just picking a couple, is the Division of Immunizations. And we've been really intentional about trying to work across divisions. So we have, Sargam mentioned Kiamaya Filson, actually Kiamaya Crawley now, she just got married. So congratulations to her. She's our Health Equity Immunization Coordinator. And her position works exactly between the Health Equity Office and the Immunization Division. So she's able to stay up to date with the current immunization recommendations and the practices with immunization. And then she takes that knowledge, she works closely with Sargam and the rest of us at the Health Equity Office to ensure that all of the different populations in North Dakota are able to equitably access and make decisions about the immunizations across the state. So hopefully increasing that vaccination rate for those groups. Kiamaya also helps to organize trainings and pop-up clinics with various community-based organizations. Again, that position across Division of Immunizations and her role with us here help her have that possibility and make that an easy transition for her. And then she works with Sargam and others to develop messaging to target individual special populations. And then another example of us collaborating internally is my position, which is also part of the Division of Sexually Transmitted and Bloodborne Disease. And so by working with that division, I'm able to help give some input into their community assessment process, to give input into development of different boards, advisory boards, making sure we have different voices heard. I can kind of access some of our advisory boards to pull in partners that could be part of the work within that division. And then, of course, as we're implementing and identifying ways to address sexually transmitted and bloodborne disease, I'm able to help connect the division with other folks in our department to reach all of those different populations. We also do a number of collaborative efforts across Team ND, and Sargam mentioned one with Department of Transportation. And I will say there's another way I was thinking that we were collaborating with Department of Transportation recently. They were doing a really comprehensive, a nice job with their community assessment, and they wanted to be sure to include all special populations. So they reached out to us and made sure that they kind of leveraged some of those connections we have, some of the boards we have, to reach everybody with the community assessment and be sure their voices were heard. So one of the specific examples I am thinking of is they worked with us to develop some focus groups in specific languages, and then got our assistance to make sure we reached all the different corners of North Dakota to get those folks to be at that focus group in the language that they were comfortable in providing feedback. And so in doing that, they've recently changed a lot of the things that are going on in Department of Transportation, and it reflects a lot of those different needs that may or may not have, and they wouldn't have been able to include all those voices if they hadn't connected with us. So that was an exciting collaboration. Another was the Department of Commerce, and we've collaborated with them in a number of different ways, but one that I'm thinking of was the NFI Advisory Board had brought forth the need to access different economic opportunities through the Department of Commerce, and had mentioned that it could be difficult when there's language barriers and there's time-sensitive applications out there relating to COVID. So we worked with the Department of Commerce, invited them to talk to our NFI communities, and worked with them to develop strategies to reach NFI community leaders in advance of the grant applications opening so that those community leaders were positioned and ready for action when the application came out. They were connected with community members. They had created some sites where community members could go and have someone who could speak English and their own native language, someone who had computer skills to be able to input the application and so on. So we kind of got everything in position before that application came out. So again, an example of just how we're trying to collaborate, and these other departments are excited to collaborate with us as well to help reach all of these populations that may have been harder to reach on their own. We also have collaborations with other organizations in North Dakota, of course, outside of Team ND. So one thing that we've been doing, and I think that Bev mentioned this briefly, was participatory grant making. So equitable funding allocation. We've been piloting a way of giving grants where we would be able to bring partners together and have them make grants for each other. They're sharing each other's proposals. They're deciding how funding should be split. And so, of course, we're helping to identify and make sure all of those grant goals are going to be aligned with what the work we need to do and the grants. But then they themselves are collaborating with each other, with us, in an active session and deciding where those funding streams should go. And some exciting collaborations come out of that. We find ways to partner with them. They find ways to partner with each other. So that's an exciting example of a collaboration. Another kind of interesting one was the Rotary International and some local Rotary clubs had some funding streams that they wanted to use to improve outcomes for Indigenous communities, particularly in the area of prenatal care. And so we've been able to work with them, and our 4 tribal liaisons have been amazing in being able to reach out to the different Indigenous communities in North Dakota and identify ways that we can help develop some of these prenatal care opportunities by collaborating with the Rotary Club. And finally, you can move to the next slide, Bev. We've had an opportunity to participate in some of the regional efforts to improve health. So one example is the North and South Dakota Perinatal Quality Collaborative, the NSD-PQC. So this group is a collaborative of healthcare professionals and healthcare facilities that are coming together to try to improve outcomes for moms and babies across both North and South Dakota. And they're working on quality improvement measures, trying to improve the quality. And we get a voice at the table to just continually identify strategies that could be used to improve quality and ensure that the birth outcomes and maternal outcomes for all moms and babies are being addressed with the strategies. Another example is the national organizations that we are asked to sit on. So we have a chance to represent North Dakota Department of Health on different committees and advisory boards nationally that address inequities. And so that allows us to bring forward those North Dakota concerns and also to lend our expertise and things we've learned here in North Dakota around health equity to inform national strategies to improve equity. So finally, one exciting collaboration that we've mentioned a few times here, but we've collaborated really closely with NDSU. We have worked very closely with the MPH program and have exciting connections with lots of students, both past and present. And we're going to be hearing from 2 of them. One is a current MPH student, Valentina, and the other is a recent graduate who's now at UND, Julia. So I'm going to pass it over to Valentina to tell her more about, have her tell you more about her work.
Okay, thank you, Alicia, for the brief introduction. And I would want also to thank everyone for having us here today. So this presentation is briefly to tell everyone about my work with the Health Equity Office at the Department of Health. So currently, I'm an MPH student, as stated early on, and my major is in general epidemiology. And so moving on, my work as a graduate research assistant with the Health Equity Office is working in collaboration with the team members in duties that focus on communication strategies, in which I assist with the presentation for stakeholders that highlight the importance of health equity and also to educate local clubs, organizations, and also businesses on health equity as needed. Another thing I also engage in is also with the stakeholders engagement, in which I meet with stakeholders and also convene groups to identify ways to bridge gaps in communication and services between local entities and also community members. Example of which is to discuss needs of these communities and also meet with the local and also the public schools to also develop solutions to these problems. Another role is to the strategy implementation, in which I work closely with the Health Equity Office team to implement methods to bridge gaps between the state health department and these local entities, and also target the communities who are at risk for certain problems. And also the other work I have with the Health Equity Office is to community assessment implementation, in which I assist in conducting community assessments related to HIV and STDs. So far, some of my accomplishments has been the coordination with the NFI Advisory Board, which involved creating a contact list for the advisory board to help in the early and timely dissemination of information. And also one other thing was the rolling out of the sexual health survey. In this project, it gave me the opportunity to implement my knowledge and skills obtained in my coursework in health survey research during the spring. And also another accomplishment has been the improvement of the coordination of the MCH World Woman Initiative 2021-2022, which Alicia has mentioned previously in her presentation. In this, we're able to come together to bring up a more efficient process in tracking the progress of grantees in this project. And then last but not least, my accomplishment has been the fostering of collaboration with external stakeholders like the grantees in this project and also with the NFI groups. Currently, we have certain projects ongoing, which includes the youth health needs assessments, which focuses mainly on HIV and STDs, and also the LGBTQS+ people in the youth. And last but not least, training on creating a training on first-person and inclusive language for healthcare providers to help in enhancing health equity in the state. Also, to end with my presentation, I would like to say a very big thank you to NDSU and also the Department of Health in fostering this collaboration to give graduate students an opportunity to exercise or even implement whatever it is they study in school, not just to be a theory, but also have practicals to be able to know what more to do in their career. Thank you.
Hello, everyone. My name is Julia Wilson Peltier, and I'm a full-time Indigenous health doctoral student at the University of North Dakota. So I assist in implementing a project with Rotary International, and in which the project is intended to improve birth outcomes for Indigenous mothers. So the grant was intended to support 5 Indigenous communities in the Great Plains region in creating group prenatal care programs within their communities. However, the onset of COVID made this really challenging because there's a lot of excitement, and like everyone was starting out their projects like just like a month before COVID hit, and then it just kind of came to a standstill. So yeah, we're trying to like rekindle a lot of those relationships and help them start back up with their programs. So currently my work is predominantly with the Santee Sioux tribe in Nebraska, MHA Nation in North Dakota, and White Earth Nation in Minnesota. And I assist these communities with providing administrative support and help with community engagement and outreach and just anything that I can help them with, really. And one of the projects that we're working on right now is an Indigenous Bill of Birthing Rights document for distribution, in which we're collaborating with youth from Turtle Mountain and making really cool graphics for this document that's intended to help with like birth advocacy and Indigenous population. So we're really excited about that project. So thank you.
Thank you. That actually wrapped up our whole presentation today. But Ramona, we are obviously done a little bit early, so I'm guessing that any of our panel folks would love to take a question if anyone has one.
So I'm going to give everyone an opportunity to gather their thoughts. And I have also just put an invitation in the chat. If each of you who haven't already done so can just quick say, introduce yourself in the chat and let us know your role and where you're joining us from. So I'll give you a moment to do that while you're gathering your thoughts for your questions. I know you mentioned, let's see, you have the new advisory board on the horizon. What are some other things that are on the horizon, or your wish list, or you know, directions for the future, Chrissy?
Oh boy, you have to take a look at those strategic plans. I think when Katarina said the 109 activities just within the COVID-19 plan, and you know, there's a ton more in the Health Equity Office strategic plan. So we definitely have a lot on the horizon. I think a lot of the things that we're looking at now is some training efforts. I think Valentina mentioned her work on one of the trainings specifically. So we've got a whole training plan that is looking to be executed. So I think we're really excited about being able to offer some more trainings that are a little bit more North Dakota specific. And that we really want to be able to push out to providers and other partners that we have. So I think that's a really exciting thing on the horizon, but we've got a lot of our team here, so I can open it up to anybody else that wants to answer that question as well.
I think Chrissy's right. The health equity training the different kinds of trainings that we're working on we're really excited about those, trying to develop really robust trainings that have quality improvement pieces to it. So it's not just learning, which learning is great, but also that implementation part of being able to find ways to implement equity changes in your facility. And so we're excited about that. And we're working closely with NDSU and NDSU interns on developing some of those trainings. Another thing that I think is just important to mention, and we're always looking for ways to work upstream more and more. So all the collaborations we mentioned in each of those meetings, every meeting we have, we're looking for ways to move upstream into places that we can impact North Dakota citizens at a broader level and a level that's closer to the source. So I think that's always on our wish list, Ramona. Just finding ways to move that work upstream is going to continue to be on our wish list for the rest of our existence.
And two, I think a lot of what a lot of the individuals in the office are doing, especially in those liaison positions, is continuing that community engagement and meeting new partners that we haven't worked with before. I know Sargam went and hit the road a month or so ago and learned about a lot of NFI community agencies on the western side of the state that the department hadn't worked with before. So I think that continuous community engagement that we're having is awesome and will continue. Keeping in mind again that this office grew pretty fast and there's a lot more of us now. And so I think that that's just going to be ongoing, especially in this front side of having this reestablished but newly formed office with more individuals. Is that continued community engagement, I think, is really important.
This is Leslie Lamb here. I'm trying to process all of the information. I think I'm a little bit paralyzed because I'm in awe of just how much you are all doing and engaging with. And so I'm sitting with this, and I know that there will be many more questions, especially as I peruse your website. But one question that just came up based on, Alicia, what you were talking about, the training modules or the training sessions that you're developing for organizations or teams. Is there a specific type of organization? Is this for anybody throughout the state that wants to get this? And how do you get the word out to say, once these are up and running, how is this going to be available to everybody?
Right now, one of the trainings that we're really focused on is one that would be primarily for public health and healthcare facilities. I think our goal, even later down the road, is to have that broader and reach more and more folks. But as we were working on developing the training, it was clear that there's specific pieces of the training that really need to be focused on specific groups. There's not going to be something that's going to have such a broad brush that we'd be able to impact health equity at some global level with a single training. So right now we're focusing on health equity within healthcare facilities and those who are serving patients primarily. And that one we're planning to roll out in the spring. And to address your question of how are we going to do that, we're partnering really closely with, well, hopefully all of you on this call to get the word out. I know every time I'm talking to a partner, I'm like, by the way, we're going to have this coming out, and make sure you keep in touch with it. And we're also going to be partnering really closely with the North and South Dakota Perinatal Quality Collaborative. So that organization that I mentioned briefly with collaborations, it's gaining steam, it's gaining momentum, and it has a lot of different healthcare facilities across the different, both North and South Dakota. And we're having conversations with different payers such as Blue Cross Blue Shield to make sure they're part of those conversations so that they could be integrating this training and helping us push it out. So I'm hoping that we're going to have a pretty concerted effort, coordinated effort to get that out, and all of you would be hearing about that. And for those of you in public health, I think it'll be pretty relevant for you as well. So, and I did see somebody asked a question about staying in the loop. And so that'll be a great segue into that question. I can pass that over to Christy on the best way to stay in the loop.
So the loop question sounds like, Sarah, it's specific to the train the trainer for the COVID vaccine. And I hate to do this since Kiamaya wasn't on the panel today, but as we know, we have a lot of staff that was not on the panel. It was just a subset. So Kiamaya, did you want to go ahead and talk a little bit about that train the trainer? And I apologize for totally putting you on the spot, but
for Train the Trainer is completely available for anybody who's interested. We've partnered with a lot of community-based organizations. Some churches have reached out wanting to get some of the training. And so you can either email me directly and I can put my email in the chat, or you can go onto the North Dakota Department of Health website and there's a link there for a request for education. And I can also put that in the chat. And things with COVID are changing pretty fast. So the Train the Trainer that I have right now is pretty updated from the Train the Trainer that I had back in May, because of course now we have boosters, we have pediatric vaccines and things like that. And so we keep it updated with the current facts of COVID, but at its core, it's addressing some of those pieces of misinformation that were popular within the special populations, or any population really within North Dakota early on during the pandemic. So, and we also try to tailor it to the group that we're giving it to, because some of it can be kind of technical. So for instance, 2 days ago, I did it virtually at the Fargo Adult Learning Center. And so everyone there, English is their second language. And so I couldn't, I had to, build in time for the interpreters or translators to give it out in those languages. And then I also had to make sure that for those students who are going to listen to it just in English, that the language wasn't so high level that they couldn't connect to things they were learning in class. So we make it accessible to whatever group we're doing it or presenting it to. And it's really enjoyable. And there's also some time built in for questions, because we may not hit every single topic or thing that's been touched on throughout the pandemic. So yeah, I'll put those things in the chat.
So Jacob, you asked how we're navigating working with IHS and tribal health departments with testing and vaccinations. And a lot of that right now, since we have those 4 tribal health liaisons, they are making a lot of contacts within those areas and really working on what the needs of the tribes are. And if it is something to do with testing, it goes back to the testing program. So those liaisons are liaising. I'm not even sure is that correct word or not, but they're letting the department know what they're hearing in those areas and what the tribal needs are. We're also offering grants to the tribes, and along with also the urban area tribal community centers as well. So some of that is being handled within those liaison positions, or the tribes directly reaching out to our testing program. The second part of your question about tracking vaccination rates with Rolette County, I'm not sure, Kiamaya, if you have any information specific on that right now. Otherwise, we can do a little bit of research on that question, Jacob. Kiamaya, do you have any information on that?
What was the question? I'm trying to go and find the question.
Oh, it's okay. I was told there was some difficulties in tracking vaccination rates within Rolette County, specifically in IHS, due to the influx of tribal members like myself that went home to receive a vaccine. How does the state coordinate with IHS to make sure the vaccination data is accurate?
Okay, thanks. So I know there is some differences in numbers from IHS between like the NDIS, which the state uses for keeping track of immunization rates. I don't know anything specific to Rolette County, but I can take it back to immunization and see if we can get an answer.
Thanks, Kiamaya.
No problem.
And just to go back to the how to stay in the loop question as well, that we are actively updating our website. So that is one way that you can stay in the loop of any new trainings or anything that we do have offered. As soon as we get them, we post them. So that's one way. And Katarina just popped into the chat that we do also have a newsletter that we go out, that goes out to partners that has let us know that they're interested in the Health Equity Office newsletter. Those are quarterly. So if you're interested in that, you can contact one of us as well, and we will get you on the listserv for the newsletter as well. Hopefully in the first quarter of 2022, we have actually partnered with a grant with NDSU and the American Indian Public Health Resource Center to establish that tribal health board. So hopefully sometime in the beginning of 2022, we will see that board.
Will there be an open invitation for that board?
We haven't really worked out the nitty gritty of that yet. The contract was just executed with NDSU, so we're meeting in a week or something. More to come, more to come.
Details forthcoming, got it. I was interested in knowing a little bit more about the work with the NFI community. What Kiamaya was just saying, it sounds like there's resources sort of for real time. You mentioned translators. Is that something that you arranged, or that was there on, happened to be part of the setting because it was an educational setting? Wondering how that real-time piece happened.
Yeah, so they did organize the translators for that specific trainer, but we have a broader contract with Ashar, which is the group that Sarka mentioned a little bit earlier. And they are community members of various, ethnic backgrounds, and they speak different languages. And so we can tap into that pool if we ever need translators for a different event. And we've done that before. We've had some pop-up clinics in partnership with Siri and NDSU that Kylie Hall has helped with. And it was at the Islamic Center, and we pulled some of those people out of the Ashar group to help translate for some of those languages. And it's been primarily Somali, because that's like a very big population there. But now, because the contract is statewide, we can pull from that group to assist in different clinics or pop-ups or anything statewide.
Those are all North Dakota people. That's terrific. Sargam, I was wondering if you had any additional examples of just some of the nuances that you've experienced working with some of the NFI communities, or just from a public health standpoint, what would have been some of your aha moments, or just the value of those connections that you're making. I'd just love to hear more.
Yeah, thank you for that question, Ramona. So I think when I first started this position, it was I didn't really have a lot of background working with a lot of ethnic communities. The only group I had basically worked with was the Bhutanese refugees group, and then briefly with Somali communities, and it was all through contact tracing process. But then I think the factor that has helped me most in terms of working with the immigrant groups is that I'm an immigrant myself, and there is this sense of connection and empathy with the groups. And I think when I started working with these ethnic groups, it wasn't really quick and easy to navigate through that team, because it's there are cultural differences, there are personality differences, and so on. But being an immigrant myself, I think I just try to put myself in their shoes and see, okay, this person is saying these things because they probably think about this thing in the back of their mind. And I think a lot of the times I talk to Alicia and say, okay, I think this person is probably thinking this on the back of their mind, because it's I'm an immigrant, and I think I can see where that's coming from. So that's like how I try to navigate within the group. But it's been a great learning experience. And I think these people, the NFI group, they are like the most, like one of the aha moments for me was when I went, made that road trip to the Western North Dakota. I went to Dickinson, Williston, and Minot. And I had a totally different perspective of the West. I thought it would be too remote because I had never moved past beyond Bismarck. That was the farthest I had been. And when I went there and I did those stakeholder meetings, people were so grateful to have me there, and they kind of like felt valued. And I think that's what I learned from that meeting, is that people will value you more if you just try to make some effort going there and talking to them. And I think we try to talk to a lot of partners through emails, and we were just hitting roadblocks. Like we were not being able to get anything from those emails. So Alicia kind of was the one who pushed me to make that trip, and I was like, okay, and I'll go there. And I made a really short trip, but it was the most fruitful. So I think if we make more efforts in terms of like traveling and actually going and seeing people in person. I know it's difficult with COVID, but certainly making those attempts to hear people out and try to make them feel that their values and opinions matter to us as the staff of Health Equity Office. And we just want to know what they need, what are they facing in their communities, what do they feel is needed. So I think that's that little bit of effort really counts a lot in the NFI group. So that's what I've learned so far in this process as my role here.
Thank you.
It's not always easy, but it's a totally different track that I'm in right now. So I'm kind of like, I talk to Alicia and I say, I'm loving my job right now. So it took me a while to figure out what I'm exactly doing. But now I think I'm just in a place where I can see what I'm doing, and trying to make sense of whatever I do, and trying to see if I can make any difference in the community that we serve.
I think when there's brand new positions being made, like yours, or I'm thinking of Katarina when she first came on, and hearing some of her, like, I don't exactly know what I'm doing yet. I think there's a process of creating that work yourself. So I think it's a real testament to Chrissy and Kim and whomever was doing the hiring, that they found people who were gonna, go and make this position something really special. And clearly you're a really good fit for that role.
That was the exact thing that Chrissy had said in the interview. She said, this position will be whatever you make it to be. You just work through it and take it to wherever you want, but it's yours to create and yours to form. So I think that, that was the exact thing that Chrissy said in that interview for the job position.
And that can be uncomfortable sometimes. I know I'm kind of thinking of students who are on the call right now, like, that can be a real uncomfortable space. So
and I think we're so used to, like, since I was in the infectious disease track, I was used to seeing results like spontaneously. So I was doing tracing. I knew what I had to do. I would just check off at the end of the day and say, okay, I did this today, and get it done. So now here it's different, because we just keep on having so many meetings and discussions, and we try to do so much work around the community, but the results aren't like, they're not spontaneous as we been used to. So I was telling Alicia and Chrissy, like, I don't feel like I'm doing anything. So that was my concern in the beginning of this role here, because it's a lot of like meetings and talking to people, planning, and like, I don't know what we're doing. So that was my feeling for the first few weeks, but that's how public health works basically. So we just kind of have to roll with it.
Yeah.
I think that's been I'm sorry, Rhoda. I think that's been thank you, Sargam, for saying that. But I think that's kind of honestly this office in general. The whole office is fairly new. So it's exciting to watch every one of us grow and make these positions what they should be, because they weren't there before. Mine wasn't there before. None of these positions existed up until, the last couple of years. So I give a big kudos to each and every one of them, because we did hire the right people for the right jobs, because they are making it what they need to make it. And I couldn't be happier with who we hired for all of these positions, because they're doing a great job. And it does take time. We don't see those results right away, and that can get frustrating. But I think that is part of public health, is that it's not all disease investigation. You see the answer right away. So patience is a virtue, I think, in a little bit of a way for this office too, because some of the things we are doing, we won't see that impact for a while. So, but yeah, it's been a roller coaster for everybody, I think, but I think we're finding our steps now. So it's been exciting at the same time.
And all I was going to add, and Chrissy, you're the consummate boss who makes sure that phrase is shared with everyone, because you're right, it's just such an amazing team. Oh, I think I just lost my train of thought because I was thinking about your team. Oh, just that the time that it takes. Sometimes I think we undervalue or don't even acknowledge the time it takes to be building trust with our community partners. And so like Sargon was saying, that just being there, just showing up. Unfortunately, sometimes we'd like people to answer all our emails and the next step is to pick up the phone, but sometimes actually being there, which of course COVID has made harder, but I am grateful for Zoom. A group like this can come together and, and learn from each other this way. But yeah, that time is really important. So Alicia, you were thinking, do you have a suggestion maybe of a question that our interns could answer for us? Okay.
Oh yes, I would love for our interns to talk about what is the biggest thing that they've learned working at the public health department.
So for me, being an immigrant and also from a very different culture background, with my work with the Health Equity Office, I've learned to accept every culture, no matter what, and also how to learn to adapt to change and different cultures as well. Yeah, to be able to bring up the right results, you have to accept and be willing to learn and also unlearn. Yeah, that's one thing I've learned. Yeah.
Learn and unlearn. I like that. That's very important.
I think Julia had to hop off, Alicia. So
okay. Alicia, my other question was for you. I think the work, you mentioned it, you mentioned so many things, but I think the participatory grant making is something very new that a lot of people maybe haven't thought about. Could you say a little bit more about what that process was like, sort of the first time a team came together, and what that's about, why the Health Equity Office is doing that type of grant making?
Sure, I would love to talk about participatory grant making. I'm always so thankful for the American Indian Public Health Resource Center and their MCH Summit, because I first learned about the participatory grant making through a health equity summit, the MCH Summit that they had it was a number of years ago already. And I didn't have any way to implement it at the time, but just brought those partners that I met at the summit and brought those ideas that I had at the summit and was able to, North Dakota Department of Health was interested in using those strategies. So we are all so connected, and the things we're presenting at different summits and conferences, it's making an impression on people, and we're pulling those partners into other projects. So that's the preface to my conversation about participatory grant making. So participatory grant making is one way of kind of collaboratively giving grants. We really love it at the Health Equity Office because it's transparent. I mean, for those of you, this is an academic setting, you've applied for a grant probably, and you submit your application and you painstakingly try to figure out what the grantor is looking for, and then you submit it and you hear back. Who knows when you're going to hear back, and it's a letter in the mail saying yay or nay, and you don't really know what you reached or not. I know that process has been shifting and hopefully is a little bit better for everybody, but that's been my experience applying for grants, and it's really deflating. And even if you get the grant, you don't know how to repeat the success again. So I think participatory grant making takes away all of those all the black curtain, and we invite partners to share what they plan to do ahead of time. We work with them. Part of our process is making sure we work ahead of time with them. We have conversations with them, explaining the process, explaining what we're looking for, what we're not looking for, helping them tailor the project to make it so it's really going to have a great impact for their communities. And then we bring them together and they share their proposals with each other. And the proposals that they've created, we ask them very specifically to not spend more than about a page describing what they want to do, and to make it plain language. They can also choose to make a little video for us and just spend 5 minutes talking. So we got one of our proposals was just the project manager saying, this is who we are, this is what we're thinking of doing. So it was, we try to make it easy, accessible for folks to develop their proposal, and then lots of interaction on the front end. They come together in a session, and ideally it's a day-long session. Our first attempt, we were in the midst of COVID, so we had only a couple of hours to try to do this online. But this year, we're planning to have an in-person session in January. And we'll be bringing people together to spend a whole day together, eating and sharing about their proposals, and they'll be able to tell each other what they plan to do. And so each partner comes to the table and is given a pot of money. So part of that pot, it depends on the size of the funding we have to allocate, but part of that pot they'll keep. So I think the last time it was $1,000, they knew they'd walk out the door with 1,000. But the rest of it, like 9,000, for example, they will be allocating to other projects in the room. And so as each person shares, they're taking copious notes, hopefully, and they're identifying what's going to be great about that project, ways the person or that organization could improve the project. And then there's a sharing session where people share, I want to give Chrissy's organization 1,000 of my pot of money because I love how innovative this project is, and how closely connected she is with her community. Another community, they might say, well, it seems like your organization has access to a lot of other resources. And I love your project, but I'm going to give my $1,000 to a different organization because I just feel like maybe you can come up with that extra 1,000. So there's this transparency where you're not sitting there wondering, well, why did I get the money? Why didn't I get the money? There's follow-up conversation. There's an opportunity for questions and answers as each person describes what they want to do. And then there's really cool collaborations that can happen. So people get ideas from each other. And that's one of the feedback pieces that we really were excited about, is they said, I just learned how to do a better project because I heard what other people were doing. And we also had people in the session that said, oh my gosh, can I reach out to you and learn more about that? Or, do you have a connection there? I would love to learn about that. And so people were connecting, and they could even come up with collaborative projects across them if they chose to do that. So that's been our process. We're planning to do that again this year, and we'll be inviting those folks probably to Bismarck in January to work with us again.
That's fantastic. One of the things that I've heard from this process that maybe is intentional or not intentional, but it does seem like it's meant to give maybe smaller organizations who don't have this formal grant writer and all this experience with these really in-depth grant proposal processes more of a leg up. So it is an equitable approach in that if somebody was to turn something in and you're like, oh, I don't quite like that, you'd actually go and or if you say you're missing this, you'd actually go and talk to them rather than just turn it away. So I think that's equity in action there, which is really inspiring.
We have been really intentional about inviting people who've never even had a grant before, but certainly those who haven't had a grant with us before, because it's a different kind of process with us. And so, yeah, that's exactly what we're hoping with this, Ramona, is to get those organizations that they're a half volunteer position is all they've got, but it helps them build capacity and get that confidence too, to be able to apply for larger pots of money maybe later on and build their skills.
Excellent. Well, I think that's a wonderful note to end on. I want to thank each and every one of the Health Equity Office team members who presented and Kiamaya on the fly. Thank you. So yeah, just really appreciate you taking the time.